Hello, everyone. I'm Camille Tootie. I'm the principal writer at the Tech Writers Bureau. I'm also the former executive editor of NextGov. I have the pleasure of moderating today's conversation, Accelerating Digital Transformation to Improve Health Outcomes. The transformation and modernization of IT systems is a priority for government agencies. Health organizations are under additional pressure to implement effective digital transformation, while also maintaining personal data, such as health records. Many turn to cloud and emerging technologies to modernize, but they often face hurdles. For today's conversation, I'm joined by Alex Muggy, who's the Director and Deputy Chief Health Informatics Officer at the Centers for Medicare and Medicaid Services, and Brooke Pierce, Leidos Vice President and CMS Division Manager. We're going to explore secure, scalable approaches to accelerate federal digital modernization efforts. We'll talk application and data center modernization, secure development operations, cloud migration, and intelligent data analytics to help improve your IT environment. Just some housekeeping before we get started. First, thank you to Leidos for sponsoring today's important conversation. Also, throughout the event, I encourage you to get active in the chat. We hope you'll contribute to the conversation on how to tackle some of the government's most complex modernization problems. With that, I'd love to get the conversation started by having our panelists provide a brief introduction. Alex, let's start with you.
Sure, thanks. My name is Alex Muggy. I'm the Director of the Health Informatics and Interoperability Group at CMS. I'm also the Deputy Chief Health Informatics Officer for the agency. My team here at CMS oversees the interoperability and health IT initiatives for our agency. So we help to coordinate those efforts across the various centers and programs that CMS oversees. And we're also responsible for CMS's interoperability rules. So we published the CMS Interoperability and Patient Access Final Rule in May of 2020, and the CMS Interoperability and Prior Authorization Rule in December of 2021. So lots of work on policy surrounding technology and modernization of the standards used for that technology.
And Brooke?
Good morning. Thank you for having us. My name is Brooke Pierce. I'm the Vice President and Division Manager for our CMS division within the health group at Leidos. And so my role within the organization is really to help do whatever we can to further the CMS mission, more specifically from an IT perspective, but absolutely from the healthcare and really the mission of CMS.
I know many organizations are currently in the midst of transforming their digital operations. So let's kick off by talking about your organization's approach to IT modernization, Alex. What type of mission objectives is your team currently trying to address or modernize?
So it's thinking about CMS in this context, there are really two sides of CMS. In the health IT space and in the modernization space. So there's the operational side of the house, and that's the part of CMS that oversees the Medicare fee-for-service program and that implements that fee-for-service program for our Medicare beneficiaries. And in that, CMS is the largest payer in the world with significant health IT systems to ensure beneficiary benefit coordination, as well as payment to all of our providers. And then there's also the other side of the house for CMS, and that's the side of the house that oversees and regulates other entities and oversees the programs that CMS has statutory authority over. And so on that side of the house, we're more of a policy shop where we write the regulations and the policies that oversee those programs and really regulate some of the technologies that they use. So my work tends to be more on the policy side of the house. We write policy that regulates technology in these programs. And on that side, we're really working to make sure that we modernize technology in our programs in a way that supports interoperability and supports the use of better standards in healthcare, and trying to ensure that we balance our regulations such that we're not locking these programs into a particular technology that can become outdated, but that we're keeping pace with technology modernization, and that those programs are able to keep pace with technologies as they're updated. So for example, if we write a rule that requires the use of a particular standard, but we know that standard is going to be updated in the near future, we have to keep an eye on that and make sure that we're updating our policies and regulations so that the entities we regulate can also continue to update and innovate and modernize. And then going back to that other side of the house, the Medicare fee-for-service side, where we are the largest payer in the world, CMS is also ensuring that we are modernizing our health IT systems so that we can ensure better digitalization of the data that we have, ensure that we are implementing APIs, application programming interfaces, to support better exchange both within our organization and also with the data that we share externally. And we're looking at the standards that we use for this technology to ensure that those standards are continually being updated and evaluated to ensure that they're supporting interoperability. So for example, we're looking quite a bit or working with the HL7's Fast Healthcare Interoperability Resources or FHIR standard, and trying to make sure that our systems are operating on wherever possible, migrating to the FHIR standard to ensure better interoperability of our healthcare system.
And you mentioned technology. So when we're looking at the growing healthcare and technology trends, such as agile or human-centered design, how will those play a role in future modernization efforts?
Well, I think Agile has already been made a pretty incredible impact in the way that we do business and do our development at CMS. And I know that's true across the healthcare industry. I'd say with the human-centered design, over the last few years, we've really seen an incredible increase in the use of human-centered design for both our technology and for our policy work, actually. So we have whole teams now at CMS dedicated to human-centered design and ensuring that we're really taking the consumer or the patient perspective into account. And I think that will probably change the way that we look at our technologies and the way we prioritize things within the agency. I think that this approach has also helped us to just dive deeper and in some ways discover things, issues and problems we didn't even know existed. So in some ways that's helping us to identify new priorities and allowing for that shift and flexibility to make sure that we're focusing on what's important for our end user or, most importantly, our patients.
And Brooke, what do you see in the space when it comes to these healthcare and technology trends, and how will they really impact tomorrow's digital modernization efforts?
Yeah, I think it's really the focus is on delivering outcomes and not just outputs, right? So the whole point of Agile delivery is to ensure that we're building those increments and they have value in the outcomes. And to go along with what Alex was saying, from our perspective, it's important that we understand the people who are writing the policies, running the programs for CMS, creating those services, and that's where the human-centered design really comes in. And we're working collaboratively to understand the context and flow of their work so that we can create solutions that reduce the burdens associated with those. So we're really taking human-centered design as really a method that helps us to ensure what we are building for them reflects what the end user needs. And that we're building it in a way that encourages engagement and use of those digital products. So that, ties into all of the digital modernization. And it really helps to de-risk IT investment by CMS, by other healthcare agencies and other healthcare companies, that it enables focus on delivery of products that have value. So that technical debt and the design debt are dramatically reduced with this approach.
And Alex, you mentioned human-centered design with policy work. I mean, we know how it's used in technology or, delivery of technologies, but how would you say it's leveraged with policy work?
Yeah, so on the policy side, we historically, we've been always trying to solve a problem or trying to answer a congressional mandate with our policies. So we write the regulation to do what Congress told us to do, or to solve a problem that we've seen in healthcare. And I think with the human-centered design approach, we're taking a much more stakeholder word stakeholder is so generic, but more of a patient, provider, clinician focused effort at looking at these problems and saying, how does this individual piece of policy impact each one of those stakeholders that it touches? And how can we better customize our policy development to ensure that we're seeing those problems up front? So we're not implementing something that we'll have to continue to refine, but that we're addressing some of those challenges up front and really meeting those stakeholders where they are. If we're going to regulate a clinician or a hospital setting, really understanding how this is going to impact them and tailoring those policies to ensure that we're not introducing additional burden with the policy, but that we're actually addressing the problem and to whatever extent is possible, reducing that burden.
There are challenges with turning actionable insights with healthcare data, such as cost, privacy, and security, compatibility with legacy systems, and interoperability. How have you seen organizations overcome these challenges? I'll address Brooke. What might happen if these issues and challenges aren't addressed?
Yeah, so, it's really, when we think about this, it's about coming up with incremental solutions for the immediate needs and development of those common standards and APIs, so that in the long run, they help enable improvement in data quality and integration among the systems. And I think that's one of the biggest problems when you're talking about interoperability is that data quality and the integration. Because if you're starting with data that is not of the best quality, it becomes much more difficult to integrate those things across systems. And so, there needs to be, I think, also that a real clarity on expectations of the why. Why is data being collected? Why does it need to be integrated among the systems? And use that question to help answer why we're doing this. And if we can take that, then we can look at and use those APIs that are going to help us to, really look at long-term trends. But on the other hand, it's also about developing common standards. When you're looking at interoperability across systems, hopefully across agencies, there has to be common standards, because you're looking at an enormous amount of data being collected and the need to do research on that to help us get to the answers. That's going to help us understand healthcare across different populations, states, demographics. You're talking about social determinants of health, and it'll enable various systems to be able to talk to each other through API integrations. So it's really about data quality, integration, and then common standards. And I have seen many organizations overcome this. Leidos is one of them. We're doing the largest EHR and interoperability implementation across the VA. And so it can be done, but there are definite challenges and issues with doing that. I'm sure Alex is aware of that. And, certainly from the policy perspective, she can definitely speak to that.
Alex, do you want to add to that?
Yeah, a bit. I think you make some really excellent points, Brooke, about the data quality and the value of having good quality data. Because if you're exchanging bad data, you're going to end up with bad data. But to the extent that we can standardize and ensure the quality of our data up front, then when it's exchanged, it arrives at its destination, hopefully in a usable format. I think going beyond that, making that data actionable is sort of the next challenge, because even if you have excellent data, but there is no actionable insight, or the end user does not understand that the data is available to them or know how to use it, then we still struggle with a system that has an enormous amount of data. I mean, CMS alone, I know we have truly an enormous, almost insane amount of data, and the healthcare industry overall has so much data flowing, some siloed in particular systems, which Brooke was addressing, is we're working towards getting to that interoperability and the integration of APIs to make that data exchange more of a reality for all of those systems. But once that data is flowing, we have to make sure that it's actionable and usable. And some of that just comes down to the end user design and making sure that on the clinician side, making sure that there's an app in the EHR that can interpret that data and present it in a usable way, so that that clinician's not spending an enormous amount of time trying to interpret all the information that's in front of them, but they can really, I should say, not trying to interpret the data that's in front of them, but instead we take that data and turn it into information that they can use. I think that this is working. I've seen, in many EHRs, in some ways that data integration is working better than others, but it's still a challenge that I think we're going to continue to have to work through as more data becomes available, particularly as we make data available to patients, because patients historically have not engaged in their healthcare data in the same way that a clinician would, or that someone who works in healthcare would. But as we make this data available to patients, making sure that that quality data is being transmitted to them in a usable way that gives them an actionable insight so that they can actually take ownership of their healthcare, that's the next step for us, I think. And I think that there are huge challenges there, but I know that there are many folks that we work with that are very passionate about this that are going to help us to achieve that.
Have you been able to get any best practices when it comes to this? Are you learning from your, agency counterparts or industry folks in terms of, solving this issue or this challenge?
So me personally, or Brooke, you may have more on the implementation side to speak to.
Yeah, when you talk about solving this problem, it is a very large problem with a high magnitude of effort, right? And so we are looking at different agencies. Are they doing this? How are they doing this? How are other companies doing it? There's also a difference between private sector and public sector. And so what are the Googles and the Amazons and the Apples of the world doing? And how can we bring that into public sector work? And how can we, I would say, collaborate with them, get those best practices? But we're definitely doing that. We've done it in Leidos. We've got a very large amount of capability doing this, and we're gathering those best practices to take them into other agencies and other areas. And there's also a large number of groups that are coming together to try to solve this problem and sharing those best practices and sharing lessons learned, what's worked, what hasn't, because I think everybody in the industry, whether you're on the contractor side or whether you're on the federal side, we all understand this is a very large problem. And as there is more data, as CMS grows, which it is every day in terms of beneficiaries, the problem is just growing. So I think we're all very cognizant of it and working together to try to solve it.
So Brooke, we've seen how events as the pandemic or the rise in cyber attacks have increased the urgency for data protection in healthcare. What have you seen in terms of agencies getting ahead of potential threats? And how do you maintain that knowledge of and visibility into what you need to protect to better support health missions?
I think it really goes to the ability of organizations to maintain the high standards when it comes to security. And then when you also pull in, because of the pandemic and the remote work environment and remote work locations, it's imperative to focus on how we provision that access to individuals, how we verify equipment, roles associated with each, all of the agencies, CMS, we all went remote. So there was a very large effort to look at cyber, to look at how we are managing access and how we continuously track and monitor vulnerabilities to update systems. But, a lot of it has to do with the robust cyber capabilities, and it's that constant monitoring. But there's also the shift towards zero trust architecture now, where there's executive orders, and the sole purpose of that is ensuring the focus is not just on maintaining that secure perimeter, but on ensuring the networks, the endpoints, the identity, applications, data. I kind of liken it to, you have a castle and a moat. So zero trust architecture is about putting your moat around your castle. And this is truly something where we've seen this in pockets across industries. Certainly there's pockets of it on the intel side, the defense side, that have been doing this for a while, but it is growing now, and it's something that we need to ensure. You're talking about the data of hundreds of millions of beneficiaries and creating that secure perimeter. And as I said, continuously monitoring, governing, rigorously scanning for vulnerabilities and unauthorized access. So I think that's where we need to go. Certainly that's where the White House has said we all need to go. And that's where we're working towards. But it is a cultural mind shift. Certainly it's looking at your security from a different perspective. But I will say that we are all getting there. CMS is getting there, and we're doing whatever we can to make sure that that's happening and maintaining that secure environment.
I'm curious to know if you've identified an emerging threat for health agencies. Is there anything that's coming up? You mentioned the remote workforce or the hybrid workforce. That obviously introduces new threats or widens the threat landscape. So is there anything that you've seen kind of new and emerging in the space?
I'm sure Alex can speak to this as well, but in general, healthcare data. I mean, the necessity and the want of healthcare data on the Black market is increasing every day. And so that's where all of this other cyber and zero trust and things like that come into play, because the want, and I would say the fervor with which people are trying to secure PHI, PII, and that healthcare data is just growing every day. And that's really where the cyber attacks and the vulnerabilities are coming in. So I would say that is one of the biggest emerging issues in healthcare. I don't know if Alex has more to say on that.
Yeah, I guess I'll add a little bit to that. And I understand certainly that, if it's online, someone wants to hack it. It's not necessarily specific to healthcare data. I would say that this is probably true of every industry data. But what is unique in healthcare is that is your unique data. You can't, if someone hacks your bank account, you can go open a new bank account. But if someone hacks your healthcare data, you can't create a new health history. That is something that is unique to yourself. And so I would say there certainly is concern around folks trying to hack this data and the cybersecurity threats around that. But that's also why I think, monitor this more than any other industry. We're overly cautious in this space to ensure that if we're going to make data available, that we're putting every security precaution in place that is possible. There's still things that we're going to learn from implementation as we're digitizing more of our health data in this country. There are going to be slip ups that need to be addressed, but we learn from each one of those. And I think that we take that learning much more seriously in healthcare than in any other industry. So I think that's what gives me hope, because I have to believe that, despite the risks of health data being available digitally and in the cyberspace, I think I like to believe that patients receive more benefit from that data being available electronically than they do see a risk. And I hope that message is very clear. There are more benefits to the data being available than there are risks. And so we shouldn't let this hold us back. But what we should do is learn from each of the cybersecurity events and look at other industries and how they've dealt with privacy and security, look at how they may have slipped up in the past, and find ways to try to address that so that we're not making the same mistakes and we're learning and growing and making sure that patients and providers all have access to this wealth of data that we have available in healthcare.
How do you anticipate emerging technologies like AI, machine learning, and RPA to impact the healthcare space? Alex, do you want to start?
Sure. I think so. This is a great question because I think so many of us are playing with these technologies to see what the possibilities are. And it kind of goes back to that data question that we were talking about earlier. You know, we've all agreed that there's just so much data available in healthcare, and there are so many ways that we can use it to make the best experience for patients and to improve healthcare outcomes. And I think, you know, just the nature of making the data available has brought us so far, but when you can layer on things like AI and machine learning, that will take us to the next level. That will really change the healthcare insights that we're able to gain. So for example, CMS has been working on our initiative to digitize our quality measures. We receive, I keep using the word enormous, but I can't think of a better word to describe it, an enormous amount of data on quality measures every year from providers, hospitals, post-acute care providers. We receive all of this data, and we're really trying to make a shift towards digital quality measurement, where all of that data is collected electronically and submitted electronically, and we can then take some of the underlying foundation of those measures and start to gain more quality insights so that we can hopefully improve health outcomes. And we can't do that without the use of AI. But over time, with all of these technologies, I think that we can really start to improve healthcare and health outcomes. And then also on the administrative side, I was thinking about this as you were saying the question, because on the administrative side of healthcare, there are so many administrative processes that could benefit from these technologies. Just for example, this happens to be a focus that my team is working on right now, the process of prior authorization. So that's the process whereby a provider has to submit for approval to your payer. So think of your doctor having to go to your insurance company and say, I want to provide the following items and services, and they have to do that before they're able to provide those items and services to you. So that's what prior authorization is. And right now that is a painful process that can take months to get approval. And when you think in the United States in particular about patients having to wait for treatment, it's just not something that we're used to, but prior authorization can slow up some of those processes. And with the right technology, like AI, machine learning, with these technologies in place, we can really streamline some of those administrative processes so those decisions can be made instantaneously instead of this back and forth between humans. The right technology can look at the data that's coming through and say automatically approved. That would be a significant improvement to healthcare services being provided to patients, increasing or decreasing the amount of time between when a patient requests a service and when it is received. So I think that's a huge space for us in the future. I do want to say though, just quickly, I'm sure Brooke has a lot to say here too, so I want to pass it to her, but I do want to point out that I don't think these technologies will ever fully replace the human element in healthcare. This is healthcare after all. Everyone's a unique patient. Everyone has unique health circumstances. So I'm not saying that that any of these technologies would really replace that human element, but to the extent that we can replace some of those administrative pieces, or that we can gain additional insights from the data that we have, I think that will allow clinicians to put more time back into the human-to-human interaction with patients and decrease that administrative burden. But there will always be that need for the human element.
Brooke, what do you say if you take out your crystal ball?
Yeah, well, to tag on to that, I think the big difference, people hear these buzzwords right now, right? AI, ML, RPA, and the focus is on they're continuously learning. So it's helping us to discover trends. And like Alex said, they're not going to take away people, because at the end of the day, we still need the people to do these things. But by implementing, AI, by implementing ML, they're helping us to identify areas that could be automated. And in general, improving quality of services by bringing forward that accuracy, the precision, the efficiency, and simplification to really complex tasks. So I think that's the piece of it that people have to remember, is it's discovering those trends. But that can also go back to one of the original questions we talked about, and that's the importance of having good data. Because if we don't have the good data, then we're incorrectly training our AI ML models. So it always goes back to your quality of data, and what we can do with the AI ML is very much based on that quality of data. But certainly when you talk about RPA, that's becoming more and more important, as Alex said, in the back office processing, right? We can use RPA to automate a range of services, from processing of claims, payments, improving customer service. So I think you are going to see a lot more of RPA specifically when you talk about service delivery of healthcare.
And Alex, you mentioned sort of a more future focused perspective in terms of what these technologies could do and where they could be used. But how do you take these new technologies and integrate them with your existing systems? Are there any specific challenges that you need to be on the lookout for?
I mean, there absolutely are. I think, as Brooke just mentioned, this is all learning there, and making sure that we have the quality of data, that we're using the right data, and we're using these technologies in the right way. So we're not just using these because they're new and exciting, but using them because we truly have tested and implemented, and we see quality insights coming from the use of these technologies. That's certainly a critical part of integrating anything new to your technology systems. But also making sure that we're introducing these in a way that reduces burden, and that we're not introducing new challenges, but we're helping to streamline and alleviate existing challenges. That's also something that we have to continue to look at and evaluate.
Brooke, do you have any specific best practices in terms of integrating these technologies?
Certainly, there's always best practices. There's always lessons learned, because modernizing legacy systems is nothing that's new, right? We've been doing this for a long time. As long as systems are there, they need to be modernized as technology changes. I think the difference now is that we have so many more tools and capabilities to modernize these systems, and I would say processes, that we don't have to disrupt operations as we used to in the past. As a systems integrator, that was always the line, is yes, we understand we have to modernize these legacy systems, but the downtime in order to do that, sometimes, where was the balance? And so I think that's the biggest thing, is that the how part, and it's that balance of what we can generate in terms of value to the end user, while understanding the cost of implementing that change. And it doesn't even, whether you're looking at whatever methodology and approach, Agile, DevOps, DevSecOps, HDD technologies, the goal at the end of the day, as Alex said, is it's not just looking at the latest shiny object, right? It's to understand, taking the end user, their operational process, and what is going to give us that best balance between tools and value that we're hoping to generate.
We briefly touched on culture. So I'm curious, from the non-technical perspective, what are some of the actions that need to be taken from a people management and culture perspective to make sure that data is really fueling insights and action? Alex?
Yeah, culture change is probably one of the hardest parts of implementing modern technology or newer technology. Sort of any change is always a challenge. But I think that one of the benefits that we have is, at least from the CMS perspective, we're able to really demonstrate how this is working in industry, to show how others have already used and implemented some of these technologies to advance healthcare and to advance patient engagement in their healthcare. And so some of that, I think, for us is really showing how it works and not just talking about that. But that said, this is always one of the you can implement a lot of technologies, but one of the harder things is to getting folks to use it and to use it in a way that's going to benefit their work or their health. So I don't know. I think I'm sure Brooke can speak to this well, especially working with different federal agencies and kind of bringing a different perspective. But from the CMS side, I think we've bought into the idea that we need to modernize. We understand that interoperability and these and more modern standards is the direction that we need to go. But there is going to be some of that challenge to bringing folks along and convincing them that this is the right way to spend our very limited resources and the like. So I'll pass it to Brooke.
It's so true, and it is a cultural revolution, and you're always going to have people that are on one end of the spectrum than the other, right? And so I go back to data. When we can demonstrate the power of the data, what is this data getting you? What are you going to be the decisions that you can make, the analysis that we can do, the power of the data, I feel will really help people come to adopt the culture and help to become the custodians of that. And then, we can turn that into leveraging existing data to reduce duplicative reporting, incorporating data-driven decisions into key results, OKRs. So for me, I go back to that. And I think we're just like that in general, as people. When we can see the value of something, then it helps us to adopt that. So if we can demonstrate the power of the data, I think that will definitely help change that culture. But it is hard, and it's about, the other buzzword, it's about organizational change management and really how you go about rolling out. You can't force these things on people, right? Whenever someone is given something and said, here, go use this, that's never the way that you're going to get people to adopt this and truly change that culture. So it's about the data, it's about how it's implemented, and really kind of the marketing and the overall change management that you use to implement it.
That's a great note to end on. And that's unfortunately all the time we have for today. Alex, Brooke, thank you for your insight and expertise. Also, thanks to our audience for tuning into this special program, Accelerating Digital Transformation to Improve Health Outcomes. If you missed a part of the show or want to share it with your colleagues, the on-demand program will be available shortly and shared via email. I'm Camille Tutti. I'll see you next time.